Good day. We gratefully acknowledge that we live, work, and play on the ancestral, traditional, unceded territory of the Syilx Okanagan Nation. Hi, hi.
Hello, I'm Elaine. With me are Dorothy, Sherry, and Stephanie. We are members of the Lived Experience on Homelessness in Kelowna, British Columbia. We thank our other members, John and G, for compiling, editing, and producing our presentation. No easy task. In 2017, the City of Kelowna began planning what has become the Journey Home Strategy and Society to address the ever-growing issues related to homelessness in Kelowna, as well as an acknowledgement of the failures of previous attempts to police the issues out of existence. A radically new kind of approach was necessary. Very quickly, Journey Home recognized the need to include and embed the voices of those directly affected by homelessness into the plan. This led to the formation of what is now the Lived Experience Circle on Homelessness, or LECO, in the spring of 2018. As an advisory group to the Journey Home Society, the City of Kelowna, and all agencies connected to issues of homelessness, including the RCMP and BC Housing, our mandate is to be a voice for the homeless and those at risk of homelessness, to create openness with understanding, without fear and judgment, and to initiate change. The work done through this new approach has resulted in 6 supportive housing sites, 3 new temporary shelters, and multiple scattered site homes in the past 3 years. More than 300 individuals now have a place to call home, this in a city of just over 100,000 people. We place high priority on including Indigenous voices and on cultural considerations. An original member of LECO, a friend of ours who is sadly no longer with us, gifted us with a talking feather before she passed, which we use proudly in our circle to respect every member's right to speak and to be heard. We are actively involved in service design and implementation through our ongoing participation, to name only a few: community advisory committees, anti-stigma campaigns, local peer employment and peer navigator circles, as well as holding a voting seat on the Journey Home Board of Directors. When new circles and committees are created to address specific issues, LECO members are at the table. LECO aims to have 10 members at any given time and has had over 25 members since its inception. We have had to cope with the sudden passing of 4 of our members. We know well that this number is likely to grow, and we continue our work with their names in our hearts and our minds.
In March 2020, at the beginning of the COVID-19 pandemic, we applied for and were the recipients of Homelessness Community Action Grant from the Social Planning and Research Council of British Columbia, or SPARC. SPARC is an independent, nonpartisan registered charity that works with BC communities in building a just and healthy society for all. The grant was to help support our capacity to connect with folks in or on the edge of homelessness, with the goal of providing a collective voice to COVID-19 planning and impacts. We set about identifying locations and decided on bi-weekly visits. We have included all shelters and supportive housing buildings, as well as outdoor sleeping sites, overdose prevention sites, and even spots where people are sleeping in the rough. LECO then shared these voices and this lived experience lens at local leadership tables, informing and directing the actions of decision makers, as well as ensuring that this expertise is embedded into policy and programming. Since April 2020, we have visited 28 locations with an average of 16 at any given time. We have done approximately 250 site visits and have made well over 1,000 individual points of contact. The relationships and partnerships we have cultivated have been key to this work.
Collaborations with service providers and stakeholders have been essential to our ability to accomplish our goals. The Canadian Mental Health Association and the John Howard Society of the Okanagan and Kootenay operate the majority of supportive housing in Kelowna. The Kelowna Gospel Mission and Turning Points Collaborative Society run the shelters, while Metro Community Church operates as a daytime drop-in and maintains a hygiene center. The City of Kelowna supports an outdoor camping site, the location of which has had to move 3 times throughout the pandemic. LECO is limited in that we are not a service provider, we are advocates. So it has been crucial to form and build these working relationships to help us meet the needs of our high-risk populations. We have also had a LECO member sit on the Kelowna operators table, a collective of representatives from all relevant agencies and service providers, convened at the beginning of COVID to address issues, plans, and strategies on how to best serve the folks who need all of our help. The operators table met weekly for the first 3 months and every 3 weeks going forward. When urgent situations arose, such as extreme heat or COVID outbreak in the shelter, the table convened within 24 hours to address the situation. LECO gave input from site visits and recommended actions and ideas. Specific situations such as extreme isolation are things that we are able to discuss with the relevant knowledge necessary. In effect, we are the storytellers and knowledge keepers of what is happening on or near the streets of Kelowna at any given time. Our from the inside looking out perspective enables us to inform and advise the true knowledge and genuine desire to connect the dots between those who need help and those who can provide it. We have been able to help guide, change, direct policies and practices. We know how to walk softly on concrete that some call home.
Of course, we wouldn't have been able to accomplish any of our visits without gaining access to the sites or without being well received when we showed up. Anyone close to the streets anywhere knows that credibility is of major and constant importance. This applies to interactions with the folks we want to help as well as with the service providers. We sent letters of introduction where necessary and posters stating when we would visit and why we were there. Often staff did not know who we were, but they got to know us and to expect our return. Maintaining staff at the supportive housing locations and at shelters has been an ongoing issue for service providers throughout COVID. For us, that has meant reintroducing ourselves and continuously working on building new relationships. We did everything with respect and with permission. We followed all COVID protocols. We adapted as they changed. In some cases, we have had to reassure folks that we serve that we are not bylaw, city employees, or any other form of authority. We cultivate credibility and make it clear that we want to listen. Even with the restrictions of COVID, face-to-face or mask-to-mask interaction has no better replacement. We are not directly connected to service providers, and because we have all been there, we hear the raw truth from the homeless. At times, we have been approached by stakeholders and service providers on issues of cultural awareness, such as the street and Indigenous cultures and the protocols related to them. We are able to always share these perspectives genuinely and with real-time knowledge because we make sure that our membership always includes these perspectives and because we are constantly interacting firsthand with the people that need their perspective included in the decisions and support structures that directly affect their lives and their quality of life. We attempt to approach all of our interactions with respect, dignity, and sincerity at the forefront. It is consistently the best method to ensure that we will be welcomed back to continue ongoing conversations and to assist where we can. We are determined that the value of this work be practical, effective, and ongoing.
The value of this work has several aspects. For us as individuals who have been homeless and on the streets, the ability to help others is a reward that is hard to measure. We help create a safe space for conversation and are able to give practical, helpful advice and information. We know that consistency and reliability can have major positive impact for people who often just need someone to listen to them. It sounds trite, but it will always be a fundamental truth when interacting with at-risk population.
The relationships we've been able to foster with service providers are essential. We are quite often able to cut through red tape to connect a person in need with the service that can help. Our message and intentions don't change. We evidence through our actions that we are what we say we are. This isn't true just because we say so. I know that can only remain true through actively prioritizing a genuine, sincere, and empathetic approach.
We have no agenda other than that of our stated mandate. Being able to meet people where they are at instead of where someone else thinks they should be is of prime importance to this work and to any related work. Spreading the concept of nothing about us without us to those in need of help and to those willing to help is key to recognizing the humanity of everyone involved. COVID has obviously brought challenges with it. LECO had difficulty recruiting and retaining active members. Some had their stability turned upside down. Meeting in person became impossible, and Zoom entered all our lives. It's not surprising that just accessing the technology became a hurdle for some.
Often we could not enter buildings or talk to more than one person at a time, as COVID outbreaks occurred at shelters and in supportive housing sites. Our camping sites were being set up by the city and changed locations several times, along with the infrastructure required to have clean water and outhouse facilities. Through our relationship with the city, we have been able to advocate for and participate in the development of the outdoor sites. There has also been influx of new faces on the streets of Kelowna at shelters and at campsites, particularly young Indigenous faces. The size of this demographic on the streets seems to be growing constantly and quite disproportionately.
Fear, isolation, anger, and an overwhelming amount of seemingly contradictory information spread through the street population as it did the general public. All of the instability society was dealing with was at times amplified on the streets. And alongside all of this, the ongoing opioid crisis has only become worse. As supply chains were cut off, dope on the streets became dirtier and deadlier. Addiction and mental health issues have become more extreme throughout society, and absolutely so on the streets of Kelowna. Death from overdose is a constant fact of life on or near the streets. We are all affected by it. We have all spent time talking to and caring for at-risk folks who are no longer with us. We have all lost too many friends. Aside from the constant need for affordable and diverse models of housing, the largest challenge in our work today is the desperate, dire need for safe, regulated supply of all street drugs. To us, this is indisputable. It would absolutely and immediately save lives and raise the quality of life on our whole street community, in fact, our entire community. The opioid crisis is in BC killing more people than COVID and is showing no signs of slowing down. It cannot be overstated. We desperately need a safe and regulated drug supply. Nothing short of this will effectively curb the ever-rising number of unnecessary deaths and the immeasurable effects of the ongoing damage they create. All of Canadian society is lessened and degraded by allowing this to continue any longer. It can be reversed. There is no other effective or humane option. Grief and trauma remain major challenges in this work, but are also a very strong motivation to continue the work. We are also seeing and experiencing some very positive outcomes.
Because of the relationships we built, we're often able to share information in real time. We can learn something one afternoon and share it with the relevant agency within the 24 hours. The agencies themselves have been forced by COVID and by COVID-related emergency funding to work together in amazingly beneficial ways that were, before COVID, strongly resisted by these agencies. We have seen silos come down and real work and help accomplished as a result. We have witnessed a level of cooperation that was previously impossible. It is very satisfying to see this happening. We are proud to be the grassroots organization and to be an example of how such groups can be effective catalysts for profound and ongoing change. We are active proof of strength found in people meeting in the circle with openness. We recognize the inherent wisdom of the medicine wheel.
We are involved. We have a direct role in allyship and the Kelowna Homeless Research Collaborative. We have seen the implementation of overdose prevention sites, also known as safe injection sites. We have seen the development of an interfaith collective. We have participated in point-in-time counts and helped accumulate data that has turned into real-life systems of support. We had barbecues at random in parks and in parking lots to feed people and to talk with them about their day. We have engaged with the residents of our city's communities that had questions, fears, and concerns related to homelessness issues. We have always attempted to counter ignorance with knowledge. We have seen neighborhoods that resisted supportive housing become friendly and vocally supportive. We have seen a change in approach from the local RCMP, no small miracle from some perspectives. We seen and participated in real change in our city. That being said, there are always new obstacles. We need conversations to continue so that we can help create new solutions and overcome hurdles as they arise. We know that our challenges are real, but that the challenges of those living on or near the streets are even more visceral and more immediate. Every one of us know, we can feel it in our bone marrow, that a solid sense of community and belonging strengthens individuals, empowering them to face these challenges with resolve and to access their own inherent resiliency. This community already exists, and you can find it anywhere you look on the streets. People living the daily reality and the sensory overload of street life are often too close to the swirling confusion of it to recognize their own ability to have a voice. We remain determined to collect these voices and to bring them forward.
We see the reality in practice that we are all capable of helping to save and improve lives. For us, this is not an option or a matter of opinion. It is fundamentally linked to the intrinsic worth of our individual and collective humanity. How could we in good conscience accept any other view? I greatly value being able to practice, teach, and exercise my traditional ecological knowledge and Indigenous insights for my own self-care and that of others involved in the paradigm of addressing homelessness. Most rewarding is being greeted with smiles and hearing "I love you" from those we serve. Knowing very well that anytime that could be the last time I see them. We learn so much from our marginalized population, and we ask every Canadian citizen to be willing to do the same. This is what we know to be true for the people we serve. We all need community. We all need support. We all need the time and dignity it takes to figure things out for ourselves and to be aided when necessary. We all need the uniqueness and specifics of our circumstances to be taken seriously by those who claim they want to help. Not one size fits all approach will ever be as effective. We all need respect, dignity, and to be included rather than judged.
We also need constant advocacy for better addictions and mental health services and more readily available treatment and counseling, for more affordable and more diverse housing models, for harm reduction tools and safe supply of drugs, for storage facilities available to those who are literally pushing around all of their belongings all day, every day, for single access centers for outreach and service providers so that traumatized people are not required to be repeatedly re-traumatized just to gain access to help, for more awareness of the damage done by stigmatizing approaches, even at times from those with good intentions, but who are lacking real knowledge. The knowledge and insight exists. Go look for it honestly and openly, and you will find it. Compassion, empathy, and a willingness to try to understand a stranger's perspective. These are the foundation of a better society that we can all help create. We urge all of you, go directly to the people that know, ask them honestly, and listen to their answers.
Our work is ongoing. It requires us to simultaneously be informed in the moment and to have a long view focus on where the future need will be. We are always building on the foundations of yesterday, We are always required to improve potential, to acknowledge and correct its mistakes, and to be actively fortifying its strengths. As LECO, we can honestly claim that these foundations are stronger than ever in Kelowna, and that we are determined and committed to maintain the veracity of that claim. We gratefully acknowledge the help and partnerships that have been indispensable in our work. We all have a list of names in our minds and on our hearts. These are the folks that have and continue to make our work possible on a practical level. They provide infrastructure and support actively and consistently. They didn't give us our voice. We claimed that as a basic right, but they sure have helped getting it out there in our city and ensuring it's heard. We are very thankful for the opportunity to present our story. It is an ongoing story, and we are all very much looking forward to living it as it unfolds. We ask all of you to challenge yourself, challenge your family and friends, challenge your communities, to always be willing to re-examine perspectives with the goal of building and maintaining a better, more fulfilling, more just society. Talk and listen openly to the folks in your communities who are living the experiences of being on the margins. Don't decide for them. Help empower them to be able to decide for themselves. Changes in perspectives will create better realities. On behalf of LECO, I thank you all for your time. Now let's all get to work.